Hey guys, it's Dr. Abraham here. We're at Valencia Medical Center doing live at 5 today. And our treatment of the month, this month is going to be Xeomin. So we're going to be talking a little bit more about Xeomin. I'm sure many of you guys are aware of it and had that treatment done, but it might be a new treatment for some of you. Bianca here, one of our staff members, is getting treatment done today. So we figured we'd kind of do that live too, just so that you guys can see how simple that procedure is. So Xeomin is a neuromodulator. It's used to help relax the muscles. Many people are familiar with Botox and Dysport, and Xeomin is just another option along these lines. It's good to help relax the lines. The most commonly done areas are going to be the frown lines. Sometimes we call them the 11 line, so we'll just kind of use it as to illustrate and relax, and then do the angry face again. So these frown lines is probably one of the most commonly treated area. Another commonly treated area that we are going to be treating today is the forehead lines. So as you can see, when Bianca raises her eyebrows up, you can start seeing some of these lines. We call these dynamic wrinkles because you really see them with movements, hence the word dynamic. A lot of times we also like to do crow's feet, which are these lines that you see here when you smile. I think we're going to be skipping the crow's feet for this specific treatment, and we're going to be focusing more on the forehead and on the glabellar line. So we have our product here, Xeomin. It's a neuromodulator. Its main ingredient is botulinum toxin A, and that's the muscle relaxer. Basically, very similar active ingredient to what's in Botox or Dysport. Kind of what makes Xeomin a little bit different is that it's the purest form in a way of the botulinum toxin, meaning some of the other products have accessory proteins which come with it. This one is kind of the more pure form of the product, and sometimes that helps it kick in a little bit quicker in some clients. Some clients have said that they feel it's a little bit more of a natural look in terms, because you still have some movement and just a lot softer. So it's definitely worth a try if you are into neuromodulators, and just to see if you like it. So we're gonna be doing Bianca. We're actually gonna start by doing the 11 line, the glabellar region. I'm actually gonna use a vein finder. We don't always have to use that when we're doing the treatment, but this is just a great way to help avoid bruising. We use that with Xeomin injections, sometimes Botox, also with fillers. Whenever we do any injection, there's a possibility of bruising because of all the small veins and vasculature that's near the skin surface. So with this, it just helps us see these veins a little bit more clearly, so that way we can try to avoid them, and that way also minimizing that risk of bruising that can happen with these injections. So I'm going to be looking at her forehead. I don't know how clearly you guys can see that with here, let me see if I can make that a little bit more bright. I don't know how clearly you guys would be able to see that over Instagram, but just try to make it a little bit more bright. Maybe a different color might be. I think we might be able to see a little bit. But anyways, I'm gonna kind of look here, and then I'm gonna have Bianca do an angry face again. Just gonna see how the muscle moves and relax. And then we're just gonna mark it. I'm gonna mark where I'm gonna put my injections. And relax. So we're gonna go right here, and then these are the corrugator muscles, and they're called corrugators because of that movement. And this is gonna be our main injections for that area. and then we're gonna do some injections in the forehead. Now there are a couple different ways to do the forehead. I personally like to spread out the injections over the whole area, just because sometimes when we do the injections more centrally, people come back with what's sometimes called the Spock eyebrows, where part of the forehead would move and part wouldn't. So there are a few different ways to do the forehead, but I'm gonna have you raise your eyebrows up again. I'm gonna have you relax, and more or less we're gonna go here, 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 and then we'll go right here, 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 here. Okay. I'm gonna just check in to see where I marked it, which we're gonna be trying to avoid veins as much as possible. All right. And turn this off. So we didn't really, we do have numbing available, but we didn't really numb Bianca. Most of our clients can do it without any numbing. If someone's really sensitive to pain, we can definitely provide numbing, but this is, we didn't do really any numbing here or anything, but I think she'd be able to tolerate it just fine. Don't scream. Alright, make an angry face again. Okay, relax. So we're gonna go ahead and inject here first. Okay, right here. Doing great so far.
Yeah, you don't really feel any pain. Maybe just the initial poke, but it's not very painful.
Perfect.
That one was.
There's always gonna be like one or two that you're gonna feel a little bit more, to be honest. Raise your eyebrows up again. Okay, relax. Perfect. Okay, I'm just gonna clean this area with alcohol. 1, 2, 3. Doing okay?
Mm-hmm.
Alright, and raise your eyebrows up again. Now relax. 1, 2, 3. And raise your eyebrows one more time. Actually, I'm gonna add just a little bit more here because I see a little bit more movement here. Okay. Alright, and that's it. We are all done with the injection. I'm just gonna clean it with some alcohol.
You're the best, Doc.
Thank you. So there was one out of the, I don't know, we did like 12 injection sites or so. Maybe I think 1 or 2 she felt a little bit, but for the most part I think it was pretty tolerable, I'd imagine. Alright. It's normal for it to look a little bit red afterward. That kind of heals within like an hour or two. It'll be mostly back to normal.
Do I have any restrictions for today, or am I allowed to go party on? Have fun. What are my restrictions for the day? Oh.
Where are you planning to party? She doesn't really party much, so that's why it's not a
At
big
home.
deal.
Get to go home.
But there are a few things that we ask you to avoid for the rest of the day, for the next 24 hours. Mainly, you want to keep the area clean, so no makeup for the rest of the day. We don't want you to sweat, so no exercise or really sauna, steam room, hot tubs, anything like that for the next 24 hours. And also we want to avoid too much pressure over the area, because We place the Xeomin in specific muscles and specific areas of the face. We're treating these certain muscles, and we don't want it to move around to like different muscles in different areas. So that's why we want to avoid too much direct pressure over the treatment area. So when you are washing your face, when you are applying any products or anything today and tomorrow, you just want to make sure that you're being very gentle. You're not pressing too hard over the area.
Okay. And then when should I come back in for my follow-up or for my next treatment?
So 2 weeks is when we recommend for you to kind of come in for your follow-up to see the effects, so see if you want to do any touch-up, if you want to do anything more, because it can take up to 2 full weeks to fully kick in.
Okay.
Now with that being said, most people are going to start seeing results a lot sooner, especially with Xeomin. Within a few days, 3-4 days, most people are already going to be seeing results. But everybody's a little bit different. Sometimes it can take a little bit longer for some people to see the full effects. It can kick in gradually, meaning you see some results in 3-4 days, but you're like, I wish I've done a little bit more, but then you wait a couple more days and you're like, oh, okay, now it fully kicked in, I can see it. So because of that, we always tell, we say give it 2 full weeks. That way we know it fully kicked in and we can kind of look at it then. Now, in terms of the next treatment, it's going to be around 3 to 4 months for most people. Again, everybody's a little bit different. I've seen people where it can last a little bit longer. Some people can metabolize it a little bit quicker. But for most people, it's going to be within the 3 to 4 month area when you start seeing the movement come back. We recommend that you come in for second treatment.
Okay. Should I anticipate any kind of bruising? Is there anything I can do for that? Or if it's, can I use ice when I get home if it starts to bother me? Or what?
So, I don't think you're going to get any bruising. Partly that's why the vein finder can be very helpful to in us kind of trying to, we can't 100% promise and eliminate the risk of bruising 100%, but we can definitely decrease the chances of bruising using the vein finder. So again, in your case, I don't think we're going to have any bruising. These little red spots where we did the injections are very normal. They're already actually even better than they were a few minutes ago, and they'll continue to improve. So these aren't really bruises. These are normal spots that are going to be gone, within an hour or so. And because there's no bruising, there's really no need for ice. There's no bruising, there's no swelling, so you don't really have to do anything about it. Just let it heal, keep it clean, and before you know it, by the time you get home, all that redness will be mostly gone. If you guys have any questions, let us know. I know, keep following us on Instagram because, as I said, this is gonna be like one of the main treatments we're focused on this month. So I know they're gonna be like placing promotions and stuff on it during October. So just make sure you keep keep checking out our Instagram to see when that comes out. If you have any questions, you can always call us and let us know. All right. If there's no more questions right now, I guess we'll see you guys next week. Thanks for joining us.